So is that cough just a cold or is it something else? More people are turning to smartphone apps to answer health questions. And the FDA predicts 500 million smartphone users worldwide will be using some type of health app in the next 2 years. So how do you do that? Joining me now, Dr. Steve Reisman, director of the New York Cardiac Diagnostic Center, that is. Dr. Reisman, thanks for coming on.
Thank you.
I was shocked, but you said you really like some of these. You think some of these apps really make sense to use. Tell me about that. I was surprised.
Well, one of the apps is for an ECG or an electrocardiogram. Let me give you a typical patient example. Patient has palpitations, rapid heart rate. It only lasts for 1 to 2 minutes at a time, occurs once every week. How do you check that out? One of the ways is to put a 24-hour monitor on. If it doesn't catch it, you miss it. If they have a little app and a little device with their smartphone, they could put that on right away, put their 2 fingers on it and check their EKG and see if they have a dangerous heartbeat or arrhythmia.
So it works?
I think it works. I think there's a good future potential for it. I don't think it's quite there yet.
That's amazing. So that's the Alive ECG, and you can find these on the web. So let's talk about the blood pressure app. Now, I would think this would be a great thing to have. How does it work?
Well, how it works is you attach a blood pressure cuff that's attached to your smartphone, and it can check your blood pressure, which you can do now at home with a regular blood pressure cuff. But what it does is it charts your blood pressure. You could send it immediately to your doctor by over the internet or by Wi-Fi, and it keeps a good way of seeing how you're doing all during the day as far as your blood pressure goes.
You know what's nice about these is that you don't have to be in your doctor's office to do them. And so you can get a sense of what your body is doing all the time, and you don't have to
Let's say you're anxious or upset and you want to check your blood pressure, then do it right then and there and see how that affects your blood pressure.
There's a diabetes tracker?
Diabetes tracker is very interesting. Diabetes tracker checks your blood glucose. You could take a little finger stick, put it in there, and you could type in how many carbs you're eating, and it can actually calculate your insulin dose, and it could send all that information to your doctor, and again, it could chart it and send it to your doctor or to the hospital or wherever you want it to go.
Wow, that's cool.
Yeah.
That's really nice.
Like that.
If you have diabetes, what you have are spikes in sugar, and it can happen at any time, and it's certainly not going to happen when you schedule your visit with your doctor, unlikely. There's also something called the eye examiner. It's really an eye exam. It looks into your eye. What do you make of that?
I like that. There's an eye examiner that kind of gets a picture of what's going on inside your eye. There are also apps that that the doctor can do a visual acuity test right at the bedside. He could take a chart and say, here it is. Let's see how it is. That's another eye exam type of approach using the smartphones.
35% of people say they seek medical advice online. They'd certainly be attracted to these apps. Is that always a good idea?
I think the more educated the public is, it's better. They can seek medical attention and get the right diagnosis, get the right testing done. I think it's a good thing to get information to the public.
I'm wondering if the FDA is looking at these, because how do you know that they're really reliable? I mean, you've recommended a handful here, but there are hundreds of these healthcare apps.
Well, I know the FDA did approve the glucose meter in December 2011. So there is a process where they can be approved. And of course, the other issue is sometimes with the ECG monitor, it costs $200 to get it for your smartphone. So there is a cost involved. And then, you have to get that information over to your doctor, have a way to communicate.
What would be your takeaway? If I was thinking about getting one of these, let's say I have a heart issue. I want to know what my blood pressure is all the time. What would you advise? Should I talk to my doctor first?
I think you need to speak to your doctor to see if he could work with this type of app that you have. If he can, then you could basically start measuring your blood pressure twice a day, for instance, and you could chart it on your iPhone. You can go in, and I've had patients come in and show you, here, this is my blood pressure for the last 2 weeks. It's high when I come to the doctor's office because I'm all anxious about seeing the doctor, but at home it's okay, so I really don't have high blood pressure. So that's extremely valuable.
So just because you're anxious seeing your doctor, you could inadvertently affect your results in bad ways.
There's something known as white coat effect or white coat hypertension. When you see the doctor with the white coat, your blood pressure goes up. And this is a way of looking at your blood pressure outside the doctor's office. So that's a real nice approach.
Doc, thanks for coming in. Dr. Steve, appreciate your time. It's interesting stuff. I think more and more people are taking charge, not just of their health care, but everything in their lives. Thank you so much.